Hi, this is Dr. Brian Hong. Welcome to Oakridge Orthodontics. One of the common reasons people come to see an orthodontist is because they have an excess overbite or overjet. Now, it's usually a result of a recessive mandible or an underdevelopment of the lower jaw. So lower jaw is too small. A lot of times it could be a combination of upper teeth flare out too much and also a small lower jaw at the same time. At the end, the result is that the upper teeth, now normally the upper teeth should be just a little bit in front of lower teeth by about 1 to 2 millimeters. And so with people with an excess overjet, their upper teeth are a lot more forward than the lower teeth. So obviously they couldn't bite very well. The front teeth cannot cut food properly. So that's the function. And obviously a lot of people don't like the particular aesthetic aspect of it. For many orthodontists, when they come to correct severe overbite, they will tend to suggest things like surgery to correct the jaw position. Or sometimes they will take out teeth to pull the upper teeth back to compensate for the discrepancy between the upper and lower teeth. Now at Oakridge Orthodontics, we use many innovative techniques to help patients correct those severe overbite problems without taking out teeth and many times avoiding surgery as well. How do we do it? Okay. Now in a young growing child, we can usually allow the lower jaw to grow forward into that more ideal position. That's obviously the most ideal method to correct excess overbite.
You can see here at the front teeth, the upper front teeth is a lot more forward than the lower front teeth, and the lower lip will just get trapped into the space. And at the back, the tip of the upper teeth is right on the tip of the bottom teeth, right here and right here. So the bite is off both at the front and also at the back. Now, after treatment, you can see here at the front teeth is biting much more normally. And the back, the tip upper teeth now is fitting right into the groove formed by the two adjacent lower teeth. And that's a much better or more ideal relationship both at the front and also at the back. Now how do we do this? So patient was wearing a tone block functional appliance, and as you can see here, the tone block is basically this part on the top and this part on the bottom help move the lower jaw forward and downward and stretch the growth center to help the lower jaw grow into that more ideal position. And here's another view. You can see the lower tone block, how it anchors onto the lower front teeth. And this is the upper tone block. You can see how it's anchored onto the upper back teeth. And those blocks is what help stretch the lower jaw downward and forward. Now, tone block not only correct the front and back relationship of the lower jaw, it also correct the vertical part. Now, if you look at this picture, this is before treatment, and you can see at the front, you can see mostly just the upper teeth, the bottom teeth hiding under and behind. And after the patient worn the tone block for about 8 months, you can see at the front, the upper and lower front teeth are showing evenly. So the bite has come into a much more ideal relationship.
Just by simply wearing the appliance, we already correct her bite. That's even before we starting braces to align her teeth. Okay. Here is another case of very severe overbite. As you can see, how the upper front teeth is flaring out and all the way outside compared to the lower front teeth. In fact, this overjet is about it's more than 10 millimeters. Patients were very good at wearing the tone block appliance. So this is about halfway of the treatment where to get pretty good result. You can see the overbite has reduced significantly. the back teeth start to come into a little bit better alignment, not quite perfect yet. At this point, patient is a bit older, it's going into high school. He doesn't want to wear the tone block all day anymore, and he also doesn't want to wear braces. So we decided to switch him into Invisalign. Now, to have the Invisalign work properly, we build this thing we call attachment, so the plastic of the Invisalign can grab onto the teeth and move the teeth according to our prescription. So basically it's a handle for the plastic to engage the teeth better. So patient is very good at wearing his elastics between the upper and lower teeth, which the elastic is built into the Invisalign appliance itself. And at the end, we have to achieve very nice result. You can see how well this upper teeth is fit into the groove formed by the two adjacent lower teeth. So at the end, we can achieve this very ideal bite for our patient without taking out any adult teeth, without sacrificing any healthy teeth, without obviously no need for surgery, and also did it without braces. If you have a problem with a large overbite or overjet, and the only solution given to you is surgery or need to have teeth taken out, and you have questions about those treatment methods, please do not hesitate to contact us. We'd like to see how we might be able to help.